Hey friends, welcome back to Lumani Health. I'm Steph, your nurse leader, patient advocate, and your personal guide through the often confusing world of healthcare. As you may know, I've spent years coordinating care for thousands of patients, and let me tell you, I've seen a little bit of everything. In today's episode, we're going to dig into something that many of you experience, but we don't talk often enough about: medical gaslighting. Now, if you've never heard of that term, you might be thinking, that sounds super dramatic. What does it even mean? Or maybe you're nodding because you felt it firsthand, that soul-crushing moment when a doctor waves off your concerns and says, it's all in your head. You're overreacting. Let me set the stage for you. I can't count how many times I've had patients talk with me about that feeling dismissed, confused, sometimes even doubting their sanity. This is serious because stakes are high. Undiagnosed or misdiagnosed conditions can lead to bigger health problems down the line, not to mention the emotional toll of feeling unheard. In this episode, we're going to tackle why medical gaslighting happens, how to spot it, and how to protect yourself. We're going to get practical too. I'll share real talk from my years in nursing, what I've witnessed, how we can do better, and how you can advocate for yourself without feeling combative. By the end of this episode, I want you to feel equipped and empowered. You'll walk away with clear signs to watch for, 5 phrases that can flip that power dynamic in the exam room, and a deeper understanding of why you're never crazy for seeking answers. Because you deserve real solutions, not a brush off. Does that sound good? All right, let's jump in. Remember, part of everything we do here at Lumani Health goes towards funding youth mental health initiatives. So while you're learning, you're also part of a bigger mission. Thanks so much for being here.
Okay, so let's start with the basics. What exactly is medical gaslighting? Gaslighting in general is when someone makes you doubt your own reality or sanity. In a healthcare setting, it happens when a provider dismisses your symptoms, suggesting they're exaggerated, purely emotional, or not worth investigating. Now, is it always deliberate? Not necessarily. Sometimes doctors are overloaded with patients. Sometimes they're biased, like assumptions that women exaggerate pain or that younger patients can't possibly have certain conditions. But whatever the cause, the result is the same. You leave feeling confused, belittled, or downright ignored. Here's why it matters so much. According to a Johns Hopkins study, misdiagnosed rates can be as high as 20 for serious conditions. Think about that. A large chunk of patients could be incorrectly diagnosed or dismissed at some point in their healthcare journey. And if you're repeatedly told it's nothing, just stress, you might stop seeking help altogether, letting a real issue escalate. I've had patients talk with me after 6 months of excruciating pain only to find out they have an autoimmune disorder that could have been managed altogether from the very beginning. Or young women told your cramps are normal who end up with advanced stages of endometriosis. That's absolutely heartbreaking. Serious conditions can get overlooked, and that has long-term consequences. As a nurse leader, I've seen the system from multiple angles. Providers are often stressed, short on time, or constrained by insurance protocols. I understand we're all human, but none of that should result in ignoring or invalidating patients' concerns. It's not just a bad experience, it's potentially life-altering. That's why you need the tools to stand up for yourself. If you've ever left an appointment feeling worse about yourself, questioning, am I making this up? Then today's episode is for you. I want you to know that your feelings are valid and you deserve comprehensive care. So let's keep going. Okay, let's illustrate all of this with a real example. Megan's story. Megan is 27, works in social media management, super creative, driven, all that good stuff. But for months, she was plagued by relentless pelvic pain. I'm talking can't work, can't sleep kind of pain. She visited multiple clinics, and each time the conversation went something like, "Oh, it's probably anxiety. Maybe do some more yoga or take a warm bath." I'm not knocking yoga, but if your pain is that severe, yoga alone probably won't fix it, especially if there's an underlying condition. Megan felt heard but not believed. Doctors would nod and say, "That must be tough," but then pivot to, "Try stress management." Eventually, Megan reached out to me in near despair. "Why do I feel so invalidated?" We dug deeper into her symptoms, documented them thoroughly, and pushed for a gynecologist specialized in endometriosis. Boom! It turns out she does have endometriosis, a pain condition where uterine-like tissue grows outside the uterus. This wasn't in her head, and it certainly wasn't a minor issue. Imagine her emotional roller coaster. Relief. Finally, a name for what she was experiencing, and she wasn't imagining it all. Anger. Why did it take so long? Could she have avoided months of agony if doctors had listened to her earlier? Determination. Now that she had a diagnosis, she wanted to share her experiences so others wouldn't suffer in silence. This is the gut punch of medical gaslighting. It makes you doubt your reality, sometimes for so long you second-guess every ache and symptom. That's why this conversation matters. For every Megan who's out there thinking, maybe I should just suck it up. Or, I'm being dramatic. You're not. If you're listening and thinking, that's me, but with migraines, or chronic fatigue, or GI issues, or mental health concerns, then please keep listening. We've got solutions coming your way. Let's break down the signs that you might be facing medical gaslighting. Beyond the classic, it's all in your head, because it can be more subtle than that. 1. Immediate dismissal without investigation. You come in with persistent symptoms, and the doctor immediately attributes them to stress, anxiety, or lack of sleep. No labs, no imaging, no deeper questions. 2. Minimizing language. Statements like, "Everyone has headaches," "It's just tension," or "Lots of women have period pain," "You'll be fine." These phrases trivialize what could be a genuine medical issue. 3. Shifting the blame onto you. If your provider repeatedly hints that your lifestyle, mental state, or personality is the real issue without exploring physical causes, they may be gaslighting you. 4. Refusal to consider alternative diagnoses. This is a huge red flag when a provider doesn't want to hear about other possibilities or second opinions. Healthcare is complicated. There's rarely a one-size-fits-all. From my professional standpoint, some of this stems from system-wide constraints, like time pressures, insurance limitations, or outdated training that leads providers to default to simpler explanations. But that doesn't excuse ignoring or invalidating someone. The key takeaway is trust your gut. If you feel uneasy because you're not getting real answers, you likely need a second opinion, a third, or even a fourth opinion. I've seen patients break free from months of dismissal simply by switching providers or requesting a specialist referral. And you're not being difficult. You're advocating for your health. Remember, big conditions often start with small signs. Catching them early can make a huge difference in treatment outcomes. So keep that in mind as we move forward. All right, here's the real meat. How do we stand up for ourselves without feeling combative? I've compiled 5 phrases that can turn a dismissive appointment into a conversation that at least gets you closer to answers. 1. I'd like a second opinion on this. Why it works. Providers know a second opinion means scrutiny. It signals that you're serious about your care. In my experience, hearing this often prompts them to dig deeper or refer you out rather than brush you off. 2. Can you walk me through your thought process on this? Why does that work? doctors have a reasoning pathway for diagnosis, but they don't always share it. This question gently forces them to articulate the rationale. If they can't, it might reveal gaps in their assessment. 3. What else could these symptoms indicate? Why does that work? This invites them to explore differential diagnoses. Instead of focusing on one easy guess, they're reminded that multiple conditions can be present similarly. 4. I'd like this documented in my record. Why does this work? Once something is in your official record, it's traceable. If a provider is hesitating to investigate further, requesting documentation shows you're not passive about your care. Plus, you escalate later, you have a paper trail. Lastly, if you say, I'm not comfortable with it's just stress, can we dig deeper? This will work because you're respectfully stating a boundary. You're not insulting them, you're just saying that conclusion doesn't sit right with you. I want more exploration, is what you're saying. Incorporating these lines might feel awkward at first, but for some of us, you aren't used to challenging authority. But for the healthcare relationship, it's a partnership. It's not a dictatorship. You have a right to clear explanations, thorough investigations, and most importantly, respect. A pro tip, keep a symptom journal. Log dates, times, severity, your triggers, and any relevant details. This evidence-based approach can help you present a fuller, complete picture, making it really hard for someone to wave you off. And if you suspect you need specialized care, do your research. ACOG for women's health issues, AMA guidelines for patient rights, or even the Patient Advocate Foundation if you suspect insurance or cost is a barrier. That's your healthcare compass. I've covered a lot of ground today, from what medical gaslighting is to why it matters, to Megan's story of endometriosis, the red flags, and now you have 5 powerful phrases to reclaim your voice. If there's one thing I hope you carry away, it's that you are never out of line for advocating for your health. In fact, that's exactly what we need more of. Patients who feel empowered to say, hang on, let's make sure we're not missing something. So let me recap the big takeaways in case you're jotting notes down. 1, medical gaslighting isn't always intentional, but it definitely has real consequences. 2, Megan's journey shows us exactly how easy validating pain gets brushed aside. 3, trust your gut. If you leave every appointment feeling that didn't address anything, look deeper or switch providers. 4, use the 5 phrases. Second opinion, explain your thought process, what else could it be, put it in my record, and refuse to accept a blanket, it's just stress. And lastly, keep track of your symptoms, gather your evidence, and don't be afraid to reference reputable resources. As always, remember, I'm rooting for you. We are on a mission to help people navigate the healthcare maze and to fund youth mental health initiatives because we believe no one should grow up feeling ignored or silenced. If you found this episode helpful, feel free to share it with someone who needs that extra confidence boost. We've got more resources and real-life stories here on my YouTube channel, so be sure to subscribe. And also, we have some more in-depth stories over on my Substack, so check out a notes section on how to subscribe for free. As always, it's such a pleasure to talk with you all. Thank you so much for spending this time with me. Being informed is the first step towards being truly healthy. Stay curious and keep advocating for yourself. I'm Steph, signing off until next time.